Good day, ladies and gentlemen. My name is Matthew Omorobe, and I will be presenting on Joint Commission and the Center for Medicare and Medicaid Services. In this presentation, we shall be taking a look at the Joint Commission, relationship between the Joint Commission and the Center for Medicare and Medicaid Services, which is CMS, Joint Commission Medicare deemed status. We'll also be looking at the importance of Joint Commission Medicare deemed status and notifying CMS of accreditation survey outcome and status. The Joint Commission is an independent non-profit organization that improves the safety and quality of healthcare in the United States. It was founded in 1951. It is the nation's oldest, largest, and more than 22,000 healthcare organizations and programs in the United States are accredited or certified by the Joint Commission. We will see more of that in www.jointcommission.org. The Joint Commission has a mission and a vision. The mission of the Joint Commission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. The vision of the Joint Commission is that all people always experience the safest, highest quality, best value healthcare across all settings. Joint Commission 2019. Now we're going to look at the relationship between the Joint Commission and CMS. The Center for Medicare and Medicaid Services, which is CMS, is part of the Department of Healthcare and Human Services, HHS. CMS granted the Joint Commission deeming authority because it found that the Joint Commission has and enforces standards and survey process that meet or exceed the Medicare conditions for participation, which is CAPS. The Joint Commission is required to demonstrate that its standards and elements of performance are equivalent to the CAPS to maintain the CMS deeming authority. CMS renewed the Joint Commission's hospital deeming authority because they met the standards as of effective July 15, 2014 through July 15, 2020. Joint Commission Medicare deemed status continues. A healthcare organization may choose to undergo a deemed accreditation survey by the Joint Commission and use that accreditation for deemed status purposes. The surveyor must meet or exceed Medicare certification requirements. A deemed status is awarded by CMS when compliance with Joint Commission hospital standards simultaneously meet accreditation and Medicare certification requirements. Now we're going to look at the importance of the Joint Commission Medicare deemed status. One of the importance is that it eliminates the need for separate or additional survey efforts. It also saves cost and time. At the conclusion of the enrollment process, CMS determines whether to award your organization Medicare certification and a CMS certification number. CMS may elect at any time to conduct its own additional evaluation of a hospital with deemed status through a validation survey or complaint investigation as it would a hospital evaluated by a state agency. Now we look at notifying CMS of accreditation survey outcome and status. Joint Commission issues a Medicare recommendation letter to inform CMS of hospitals' participation in deemed status survey. The letter includes information on the date of the survey, the outcome of the survey, the effective date of accreditation, and the location included in the scope of the accreditation survey. The Joint Commission also provides a copy of the letter to the CMS Central Office and appropriate regional office. The Joint Commission also notifies CMS of hospitals that fail to achieve accreditation or fail to resolve condition level deficiencies. The Joint Commission is obliged to provide CMS with a listing and related documentation for deemed organizations receiving decisions of accreditations with follow-up survey, contingent accreditation, preliminary denial of accreditation, and denial of accreditation. Now we conclude. In this presentation, we have been able to see the relationship between the Joint Commission and CMS. We also saw what it means to have a Joint Commission Medicare deemed status, and how CMS is notified of hospital accreditation survey outcome and status. From the Bible, we understand that whatever our hands find to do, we should do with our heart, our mind, because in the grave or the world of the dead where we do go, there is neither working, nor planning, nor knowledge, nor wisdom there. Ecclesiastes chapter 9, verse 10. Thank you for listening. God bless you. Have a nice day.